Hello, everyone. My name is Cynthia. I'm the project managing consultant for the new Pride Agenda. Thank you so much for joining us. We have had 3 virtual town halls, all focused on COVID. We have had 2 town halls focused on census. And we are beginning our 4th town hall on COVID related to system change needed all over our country, but we'll start small by focusing on Albany. I want to just pause a moment and acknowledge Larry Kramer, who many of us knew, who passed away today. Larry was a remarkable, outspoken activist. I knew him years ago when he started Gay Men's Health Crisis and then ACT UP, and use crowdsourcing energy, loud voices, demands, challenges to authority to try to alert people about the epidemic that was coming at that time. We could all continue to use a little of that energy. Let's just have a moment of silence and thank Larry and all the young Larrys, etc., rising up. Thank you. A little bit about the new Pride Agenda. We decided to form to pick up some of the work that was not completed by Empire State Pride Agenda. Some of us were involved in it years ago, many of us were not. But a particular focus on LGBTQ community, transgender, non-conforming, non-binary populations, people of color, people that have less resources. That is who we are trying to help. And we've created a terrific board of directors. Cecilia Gentile, Doug Worth are our co-chairs. We have wonderful people. We're advancing to increase that presence around the state. We hope to form a niche in collaboration with many of our LGBT partners to help get more people, LGBTQ, involved in civic engagement, more people educated, more people doing advocacy on behalf of our community. Our focus is that we should be present at every table, not just a healthcare table per se, but anything to do with economic development, anything to do with business, anything to do with every issue that touches our state. We essentially do 2 or 3 functions. We're education, we're C3. So our COVID series, which we began in April, is totally focused on COVID-19 and how it affects LGBTQ community. We have a collaboration with Columbia University. During June, second week of June, we will be sending a huge, a significant LGBTQ survey to tens of thousands of people to hear what you care about, what your priorities are, how you view the current work being done, so we could begin to hear what you care about and incorporate that in our advocacy. What we have done so far regarding advocacy, starting last fall, is we began to focus on very important bills such as gender and help their implementation. Because as a former lobbyist, if you pass laws and you don't fund them and fund the cultural change that's needed and regulatory change, it's very hard to make things actually work as we would like. So we will always have that focus, making sure implementation happens with, and of course, legislation, legislative advocacy, and of course, budget advocacy. So that's a little bit about us. You can read, hear more from our website, www.newprideagenda.org. And now let me turn the screen over to Ahmed Mohit. Ahmed?
Thank you, CD. And thank you everyone for joining us. I want to reiterate that it's been an especially difficult, exhausting week with the passing of Larry Kramer, the murder of George Floyd at the hands of Minneapolis Police Department, and the Central Park lady who hysterically and recklessly cried wolf all these things have made it an exhausting week. And so I want to reiterate that I thank you guys for joining us, for having this important discussion. I'm going to go over some brief logistics concerns regarding this town hall. So first and foremost, we want this to be as interactive as possible. And so please ask questions through the Q&A function at the bottom of your screen. You can also just pose any comments you might have that come to mind through our chat box. People can also interact, attendees can interact through that function in case you don't have a question but want to say something. We recommend that you place your screen in gallery view so that you see all of us in the Brady Bunch style. You can do this by hovering over the right upper hand corner of your screen. You should either say gallery or speaker view, and so you should click on gallery view to get the best optimal view. And then if you have any technical difficulties, please don't hesitate to reach out. I'm gonna post my number in the chat box. And so just shoot me a text if anything comes up and I'll try to troubleshoot. So without further ado, I'm gonna pass it off to our fabulous Jason Walker, who's gonna go over today's topic and also give some brief bios of our wonderful panelists. Thank you, guys.
Hey, good evening, everyone. I want to offer greetings and appreciation for everyone who's tuning in today for this what I know is going to be an amazing conversation working towards a new Albany as we discuss housing, education, employment, and health during the time of COVID-19. I have the honor and the duty of announcing and introducing our fabulous panel. I do also want to offer a moment of gratitude and appreciation for Larry Kramer and the work that he's done for folks living with HIV. As a person who's living with HIV/AIDS, like, I would be remiss not to mention Larry Kramer and the amazing work that he has done for laying the foundation and the groundwork for AIDS activism and what movement building could look like in our city. So I'll move on and talk very briefly about some of our amazing panelists. First, we'd love to introduce Senator Brad Hoylman, who is the chair of the Senate Judiciary Committee and represents New York's 27th State District. Brad Hoylman was also a key champion of the 30% rent cap, a landmark legislation to help expand hospice services for low-income folks living with HIV/AIDS who are struggling. I really want to thank Brad for his leadership on that issue as well. We also have Julia Salazar, State Senator Julia Salazar, representing New York's 18th District. Upon her election in 2018, became the youngest woman ever to be elected to the state Senate. Congratulations again to you, Senator, and thank you for keeping a young progressive voice in leadership up in Albany. We really look towards your leadership. Next, we have Kyle Ishmael Esquire, the Executive Director of the Black, Puerto Rican, Hispanic, and Asian Latino Caucus, and also the co-host of House Party, which was also dubbed the best New York political podcast by City and State. Yep, I did my research. Yeah, it's good. And then also we have Samy Nemir. I practiced with Samy earlier with his last name. I'm get it right. Olivares, who is the co-founder of Queer Amisu. Queer Amisu is a diverse network led by LGBTQ leaders of color dedicated to advocacy, political action, and leadership development to connect, support, and advocate for our rights for LGBTQ folks who sit on the intersections. So yeah, so that's our panel. I'm going to kick it back over to Cynthia.
To begin, oops.
You're still muted.
Hi, thank you. I think the best way to begin is to ask our panelists how each of you are and how COVID has affected you either personally or obviously with your work. Why don't we go ahead and start with you, Julia? I'm just gonna go across our gallery here. Thank you.
Sure. Thank you, Cynthia. Thank you to the New Pride Agenda, all of you who are participating and took the time to plan and host this town hall. I've been very fortunate that I haven't been sick and no one in my family has been sick. And so I feel very lucky to not have been really personally impacted. However, my district has, of course, been hit really hard. I'm at home right now in Cypress Hills. I conferenced and was in session remotely with my colleagues today, some of whom were in Albany. And the district I represent is mostly people of color, which I'm sure we'll talk more about how disproportionately impacted our neighborhoods have been. But that really has been the impact that I've experienced really has just been vicariously through my district, and I've been really fortunate to not be personally affected.
Thank you, Julia. Let me, I'm glad to hear that. And let me also add that Assemblywoman Deborah Glick had planned to join us, and perhaps she will in the next hour, but the Senate and Assembly actually went into session virtually yesterday, today, tomorrow, and so she's still in session. So I just want to acknowledge her, and if she could join, Ahmed will cleverly incorporate her. Samy, how are you doing?
I mean, as Julia said, I've been blessed that I still have health and I still have a job. I work at Lambda Legal during the day, and my family, half of them are in Puerto Rico. However, my sister is immunocompromised. She has some similar lupus-like condition, so it's very nerve-wracking. And her partner works still in the streets as a photojournalist, so that has kept our family on edge. My parents are seniors, so it's been stressful, but still I live in Bushwick in Julia's district, and in community wise it's been very sad to see all communities and dying and also hungry. So I have found a lot of fulfillment into giving back and getting involved with mutual aid efforts to stay busy and help the community while I can.
Thank you so much. Thank you. And we wish the best for your sister and her partner. Senator Hoylman, Brad, how are you and your beautiful family?
Thank you. Everyone is healthy and well for the being in the middle of a pandemic. I agree with Samy and Julia that we see this through the lens of our neighborhood and our constituents, and so many people suffering, trying to get healthy, the mass unemployment. I know Julia and I have both been fielding unemployment insurance claim calls. Cynthia, it's like a full-time job. It's really, doing the legislating work seems almost an afterthought to everything that we've been doing over the last several months, given the need in our communities. But like Samy, I feel really blessed that this is rather cathartic to have this responsibility to get people what they need, whether it's an unemployment insurance application, guidance, or PPE, or a box of pantry items, which is something that a lot of us are doing. The need is out there, and to be the intermediary for that need, it's something to be said, to be helping our neighbors right now. So I feel very fortunate to be able to do that.
Yes, you bet. We very much understand. Kyle, thank you for joining us. How are you?
Hi, Cynthia. Thanks for having me, and thanks to the New Pride Agenda. Thanks to the fellow panelists, everybody who's here today. I'm doing well. Thank you for that question. Today, I'd say is a little bit difficult. Just kind of going off of everything that Ahmed mentioned at the beginning. I found myself just kind of struggling a little bit today. But other than that, I'm blessed. Personally and professionally, I'm still working. I still have my health. COVID has touched some kind of distant family members, which is obviously just as sad as anybody else. But thankfully, my immediate family has been weathering the storm well, been keeping a close eye, but afar from my mom, who doesn't live too far from me. I live in Washington Heights in Manhattan. So at 7 o'clock, it gets very loud here with everybody, thanking the healthcare workers. But honestly, on a day-to-day basis, we're hearing a lot of, I live close to the hospital. I live right across the street from a food pantry. So, we're hearing the sirens. They've kind of waned a little bit, I'd say, in the last couple of weeks. But, there's constant reminders, that people are struggling. So yeah, just trying to do everything I can to be of help.
Thank you. Thank you. Thank you so much. Okay, let me give a little context for what we're going to discuss today. And I said to our panelists that we want to be both aspirational as well as practical. There are essentially 4 buckets that any of us who are paying attention to the news or have been aware of what's happening in our communities have been cognizant of for some time, sometimes for years, for some of us just in the past couple months. And that's the tremendous disparities that have gone on, that have been exacerbated or made more pronounced by COVID. And that is associated with healthcare and housing problems and education and employment, all of which are challenges. And I like to think that in times of pain, sometimes we could make some significant change. And if we don't start here in New York State, I'm not sure where we would. So, so with the challenges we're all facing, let me make a few words for context, and then we'll start discussing, some thoughts regarding healthcare. And as I've said to our panelists, there's no wrong answer here. It's aspirational as well as practical. If the audience wants to ask a question or the panelist has another point of view, feel free to interrupt. If not, I'll just follow the same gallery of all the handsome faces I'm seeing. So due to the disproportionate impact of COVID-19 on communities of color, and of course, LGBTQ, TGNC, BC folks, the new Pride agenda believes that there's a unique opportunity to try to do some systemic change regarding healthcare, housing, employment, and education. And of course, we're very aware of the disparities that have loomed during this pandemic. And no will understand more as more data evolves, but certain things are obviously apparent. And we hope that there will be more help for New York State and the federal stimulus. We understand DC leadership is critical, but we must pursue what we could pursue in New York. So let's start a little bit of a focus regarding healthcare. The life expectancy between the poorest and wealthiest of New York zip codes is stark, in some cases having a 10-year difference between 2 communities. The difference between areas in the Bronx and the Upper East Side is stunning. Infant mortality and new HIV diagnoses are also concentrated in neighborhoods with high poverty levels. This speaks to social ills, joblessness, lack of public investment that plague our most vulnerable communities. And we, LGBTQ, are part of those communities. We are not all of the 2%, the affluence, that is sometimes been the stigma or the association that has worked with us. Some of us have more resources, but we cross all economic levels as all of you do. And so we want to begin our healthcare discussion by talking about how could we begin to think about how to address these gaps in healthcare, proactively invest in communities which have less resources. How do we pay attention to that, whether it's clinic care or public hospitals? Everyone's under tremendous debt now, but let's try to think big a little bit. Okay, Julia, would you like to just start off our discussion, please?
Absolutely. So truly, I think that as long as we have a for-profit healthcare system, we're going to continue to see these disparities, and we're going to continue to see, even with some progress that's been made at the federal level with the Affordable Care Act, we continue to see more than 1 million New Yorkers in our state who are living without health care, right? Without health insurance. People who still can't afford to see a doctor, particularly people experiencing homelessness, or people who are unemployed, or people who are undocumented. And so in my perspective, what we really need to be fighting for is single payer healthcare. We need to be fighting to pass the New York Health Act. In New York's case, I think that there are some short-term solutions, or at least responses that actions that we can take to try to minimize the disparities between how more affluent communities have been impacted versus some of the communities that I represent, Black and Latino communities especially. We know that more than any other community, the Latino community has been disproportionately impacted. We've seen far too many people lose their lives, given the percentage of the population that Latinos actually represent, and it isn't because we are biologically predisposed to contract coronavirus, right? It is at times, in many cases, due to risk factors that are more prevalent in our communities, but many of those things are caused by chronically, historically being deprived of adequate access to healthcare, are relying more on Medicaid, on public safety net hospitals that are the first ones on the chopping block when there are cuts to healthcare in the state. We really need to reevaluate our priorities as a state. And instead of saying, how can we, looking to hospitals and clinics and community health centers first, when the budget needs to be balanced, we really need to be looking to those areas first in terms of funding, and funding them more generously so that we're prepared for situations like this.
So are you saying, Julia, that funding clinics, community health care centers should be more of a priority from your perspective, as opposed to hospitals? Is that what you're saying? Or?
I think, yeah, generally. I also think that a lot of certainly public hospitals and safety net hospitals are, people go to those places for primary care, especially if they don't have insurance. And so I would advocate strongly for increasing funding to those hospitals rather than the proposals to cut funding to some of those hospitals, like we saw, in the budget process. A public safety net hospital in my district, Woodhull Hospital, was expected to see more than $10 million in cuts. Thankfully, we fought to try to prevent that, but it really illustrates how the hospitals and healthcare providers that are already stretched thin and burdened the most by this are hit the hardest, right? And they're the first ones they're just not being prioritized.
Mm-hmm. I noticed an article, I'll just comment, I'll move to Samy. I remember seeing, first of all, I should preface this. I am not an expert on any of these 4 buckets. So I'm really coming from I no longer lobby, I'm helping the New Prodigy, so I'm just bringing a perspective of my own perspective to this. So I remember reading an article in New York Times that said something like, even the sort of elite hospital, private hospitals, I think that was your language, that's probably what they are, that don't generally serve, for example, Medicaid recipients, because everyone is hurting, we're now more open to thinking about maybe rethinking their business model and serving more Medicaid. I, from my viewpoint, found that a positive, that maybe some of the system change will force some changes. I make that as a comment, right or wrong. Anyone could agree or disagree, but Samy, I'm open to your thoughts regarding this initial question in terms of healthcare. Thank you, Julia.
Sure. First, the problem is that healthcare is not treated as a human right, right? So when we start off of healthcare as rooted in capitalism, we will have a system that prioritizes the profit of the healthcare industry as an industry, as a money making, right? And not as saving human lives. So to the extent that we could, we continue to do that, we will see the effects of and how people in their mind can justify cutting funding for hospitals amid the world's pandemic that we have seen, right? So if we're thinking about human lives and prioritizing healthcare, that shouldn't have happened. That shouldn't have even been a possibility. And it is outrageous that the state government was, contemplating and also cut funding for hospitals instead of fully fund them. A lot of people also, were criticizing the role of hospitals and the grading system that was released a few days ago, where some of the hospitals were, graded D and F. And of course, I mean, they are doing miracles with the little resources that they are receiving, right? And using that the federal government is gonna somehow, the President Trump administration is gonna send some money to the state, and therefore the state does not have to chip in and fully fund healthcare is preposterous, right? So I do agree that we need to fully fund our hospitals, as well as the community health centers, including the Department of Health centers that are, I think that we should greatly expand those community health centers that the Department of Health from New York City operates in communities of low-income communities, or communities that have a lot of disparities, such as maternity, higher maternity death, and maternally infant death. We have one in Bushwick, but they're really like skeleton based, right? So that's one thing I think in the macro level, that the Governor Cuomo and the elected officials like Julia and others have been fighting for, should making sure that, sorry, let me break that sentence, that Governor Cuomo listen to people that is advocating to fully fund healthcare. And I think in individual level, yes, the hospitals could be funded, but we know that the barrier for access for LGBTQ people to healthcare is not fully fund the hospital. It's more about having access to insurance, right? It's having access to employment that provide fully accessible healthcare, as well as discrimination, right? And so when we see these hospitals crumbling down and all these barriers, LGBTQ people have prevented themselves to, go to healthcare facilities and hospitals in fear of discrimination, retaliation, and especially the transgender community that prefer to stay home dying of COVID than sometimes go to the hospital to be misgender, right? So I think that, well, we need to address the economic and financial part of the lack of inequality in healthcare. We also need to continue working on the creating awareness and eradicating stigma and discrimination from the healthcare system.
Thank you, Samy. I should also mention that in the fall, the new Pride agenda, when requested by the governor, did a statewide survey of just targeted, it's random members, but the members of the transgender community, to ask about discrimination. And what you're saying is absolutely accurate. We found tremendous discrimination in all four of these areas. In healthcare, in having great interviews, but as soon as they arrived for the job, all of a sudden the job wasn't available, et cetera, et cetera. So it's definitely a focus of New Pride agenda, and I appreciate your raising that that particular challenge for a particular segment of our population. Brad, comments regarding healthcare and how to take on these disparities. What are your thoughts, aspirational and or practical?
Well, I mean, start with the practical, because that's kind of what the you know, the business while we're in Albany and what it's really about. I think at the end of the day, you're right, and Julia's right that, you know, we fought back against cuts. There in my district, I have 7 hospitals, and we were looking at $60 million worth of cuts that we saved. But it's still, you know, we shouldn't have been in that position to begin with. And I look at those 7 hospitals and the enormous disparity among those hospitals. Some of these hospitals, Cynthia, when the pandemic first broke out, actually had their well-heeled board members send private planes to China and Europe to pick up PPE, to pick up face masks and gowns and ventilators, because they took it upon themselves to do that. Now, you know, I guess I'm glad they did it, but I tell you what, Bellevue, also in my district, one of the world's greatest public hospitals, wasn't doing that. And nor did they have the means or resources. So it does begin at that level, and it also begins at the perspective of hospital health planning. You know, the closure of hospitals, particularly in neighborhoods that are underserved, has been, you know, a real kind of shocking, slow-moving car wreck over the last 15 years across the city of New York. Closures in my district, consolidations in my district, and all the boroughs. And, you know, we saw ourselves as a state grappling with the lack of hospital beds, and you just have to ask yourself, who's planning this? And the fact is that there's a public health and hospitals planning board that's comprised mostly of hospital industry insiders, nursing home lobbyists, private sector representatives, with, you know, 2 consumer representatives at the moment, as far as I know, although we have legislation to increase the number. But average, you know, everyday New Yorkers are not represented very well in the planning process. And I've always, you know, been kind of alarmed by the fact that it's a lot easier, it seems, in the state of New York to close a hospital than to open one. And it's a very kind of straightforward process. You get the buy-in from this kind of star chamber of industry insiders. The DOH signs off on it, and the hospital's gone. And the community really has very little recourse, even though we've fought back at a number of junctures. So from a practical standpoint, I think we need planning at the state level, with input from not just insiders, but legislators, representatives, consumers, organized labor, stakeholders of all different varieties. Aspirationally, and maybe it's not that aspirational these days, because I think we're inching toward it, is the New York Health Act. And we now have, you know, a majority of senators in our conference and across the entire Senate who support it. So I think it's a matter of time. Unfortunately, the double whammy of COVID and you know, our kind of lurching in a direction to deal with immediate needs has almost made it impossible for any of us to organize around big policy issues like that. But I think the timing is right. As soon as we catch our breaths, Cynthia, that's what we should be fighting for. And, you know, it's an exciting opportunity because it goes to the heart of everything. You began this question with which is how this pandemic has magnified these intolerable, unacceptable uh, inequities in the healthcare system among our different communities across the state.
Thank you. Thank you. Yes, I wouldn't have predicted when the conversation began a few years ago on Medicare for all, et cetera. I thought it was such a long shot, and I think it becomes less and less so every week that goes by. Let's see what happens at the highest levels of government as well, because we do need, even aspirationally to have it, we would need funding to do it. I'm going to switch to a housing question. Kyle, I hope, and I'm going to start with you, just so we could get through our four areas in a timely way. In 2017, 2.8 million New Yorkers faced housing costs that were 30% of their income. Half of all renters. Is kind of astonishing statistic. And at the same time, rental costs have increased by 13% compared with 2.5% cost in median income. So with stagnant wages, rising costs for rent, I think we have to think about this as both a short-term solution, given what's happening with COVID and so many of our workforce unemployed, stunning numbers in our state and nationwide. So I guess it's sort of a two-part question, and we'll start with you, Kyle. It's sort of like short-term, what should we be thinking about? And this housing crisis, is there anything aspirationally we could begin to think about that would have more affordable housing for folks in New York City that want to live an urban life? Kyle?
Yeah, no, absolutely. Thanks. Thanks for that question. You're right. There's the short-term question, and I think that goes for everything that we discuss nowadays, given the climate that we're in with the pandemic. And then the long term. But I think that what the pandemic is highlighting is that we have to be constantly focused on the long-term answers to our problems, because we'll find ourselves in situations like this, right? Like where we're in an emergency and we are scrambling to find short-term solutions. We're having conversations about long-term solutions, but we're not in a position to enact them because we're dealing with the emergencies of the short term. So, while it's important that, the senators on this panel are, in session, that our colleagues in the Assembly are in session and they're passing COVID-related bills that are very necessary. I think that we need to be putting ourselves in a position, we need to have those conversations now. We need to be taking some actions now. But we need to be putting ourselves in a position where when the next emergency comes, right? Like, and we live in New York, so we get emergencies, right? Like whether it's a health emergency, God forbid, a terrorist act, whether it's an act of God, some weather emergency, we're going to find ourselves in another emergency. And so, earlier when we're talking about healthcare, we need to put ourselves in a position where your healthcare is not dictated by whether you have a job or the type of job that you have. And I think similarly, perhaps not exactly the same, but similarly when it comes to housing, we need to be enacting long-term housing solutions that put people in a position to, when emergencies occur, they're not fearful of losing their homes. They're not fearful of being evicted. I'm a millennial. I grew up with everybody saying that, oh, you have to go to school, get a good job, buy a house. I think by and large, increasingly, my generation and also the generation, behind me is questioning that exact formula, especially in a city like New York City, and some of the other bigger metropolises across New York State. Not everybody is going to be in a position to buy a home. Not everybody even wants to be in a position to buy a home. Renting is a viable option for a large percentage of New Yorkers, again, especially in New York City. And so it's a matter of, regardless of whatever your choice may be, whether that's to own a home, whether that's to rent, or even attempt to become like a small landlord yourself, the question comes back to affordability, and what is considered affordable. And I think all these different policy proposals, we can talk about healthcare in a vacuum, but it plays a role in housing. We could talk about housing in a vacuum, but education is related to it as well. So I think that, all these things are related, and there's a lot of work that needs to be done on several different fronts. But specifically when you're talking about housing, like housing is key. If you are a young student, your ability to perform well in school is directly tied to whether you're eating breakfast in the morning, whether you have a safe, stable place to sleep, whether you're getting help when you get home with your homework, or what type of help you are receiving, what time you're going to bed, all of that. And so, we can have a system whereby it's filled with short-term solutions, right? Like a shelter, if you're being kicked out of your, if you're being evicted from your apartment, that's not sustainable long-term. And so, we need to be more focused on identifying what affordability is for renters, especially. Yes, that's going to take partnership with the federal level, but there are things that we could be doing here on the state level that I think that state legislators have been exploring for a while. And I think that now is absolutely the opportunity for us to be exploring those things, further.
Terrific. Thank you, Kyle. I first want to acknowledge, I would say right off the assembly floor, but at least the assembly virtual floor, Assembly Member Deborah Glick. I know you're still in session, Deborah. I appreciate your joining. And let me interrupt. We talked a little about healthcare. We talked a little bit about housing. But Assemblywoman Deborah Glick, I'd love to ask you a different question, and then we'll go right back to. So if you could get your audio on. My question is, you are on. Terrific. My question is, you have seen a number of crises affect the LGBTQ community. And I wonder if you could just give us a little perspective. Some of those that we know that are younger, including even my daughter at 22, have never seen this kind of problem before. And I would appreciate your giving us some comment and maybe some hope and perspective about working through this.
That's okay. Well, all I will say, and we're in the middle of a slow roll call, so it's a little confusing, and I'm sorry, but I don't want to lose the feed, and I think I've somehow lost some of it. But in any event, we were talking about a bill that had to do with preventing evictions, and that there was a discussion that, well, people are getting unemployment and things, they could be paying their rent, and this is just a giveaway. And it reminded me that the most important thing we learned during the AIDS epidemic was that housing was crucial to maintaining one's health. And that is the message that we should be thinking about now, that it is the very basic, there are three things you need: food, water, a roof over your head, and clothing. That's the basic. And we cannot have people lose their housing because they've lost their jobs, because they have been forced out of their employment through no fault of their own, or they are sick, or their family members are sick. This does remind me, because we had a president then who would not say the words AIDS, ignored it because they didn't care about the community that was affected. And to some extent, we're seeing exactly the same thing today. Communities of color are disproportionately hurt. Marginalized communities have poor access to health care, and they are dying at disproportionately high rates. So it is for many of us, and it's on a day when Larry Kramer passed away, a reminder that he was opinionated, abrasive, but effective. And so those are things that, yeah, I'm opinionated. And we all need to be aggressive and together effective.
Thank you. Thank you, Deborah. We're going to go to Julia. You'll stay on it to whatever degree you can, but
Yeah,
I love you and thank you for joining for what you have to go up.
Yeah, I have to figure out what
Well,
the heck I did to this to get back in
I know.
visually. I can hear them,
I
but I
know.
can't see them.
And for sure, I can't help.
I know.
Thank you.
I know.
Julia, I think you know a little bit about housing. You want to take it out? And let's abbreviate our answers just a little bit because I want to get through three other, three areas before we hit 8, 10 or so. Senator Salazar, please.
Great, thank you. And thank you to the Assembly member for joining us. I will try to be brief, but as far as short-term solutions, right now we know that more people are unemployed than we've seen since the Great Depression. So it's truly an economic crisis in addition to being a public health crisis. And in the short term, I think we really need to prioritize people who are close to being displaced or even losing their homes, renters, people who are cash-strapped homeowners. We really can act to suspend rents and mortgages. I absolutely believe that, in addition to passing Senator Hoylman's legislation to make sure that people are protected from being evicted for longer. For too long, our local and federal governments have really prioritized relief in the form of corporate welfare, subsidies for people at the top instead of for the people who are struggling the most. I really think we need to take action as the legislature and also demand action from the governor. I think another thing that we can do that would particularly help a lot of people in the LGBTQ community is demand that the governor act to prevent young people who are currently in foster care from aging out. There are a lot of LGBTQ youth who are at higher risk of experiencing homelessness due to discrimination or any other reason, and who are also in foster care. And that's something that the governor could take immediate action to help people. And then in the long term, there are, as I think there are a lot of proposals to systemically change things and to give permanent rights to tenants, and also to try to disincentivize some of the predatory real estate speculation that is driving homeowners out as well of our communities, like right here in Cypress Hills. People, we can expect that some of the predatory speculators are going to try to take advantage of distress in our local housing stocks after this crisis. And I think that we need to act as the legislature to pass policies that will disincentivize those practices and codify rights for tenants.
Thank you. Thank you. Very helpful. One of the early things I learned from when I worked in city government, New York City government, from the head of public policy and planning there was, she taught me, she said, Cynthia, always follow the money. Follow the money and you'll understand where the source of the problem is regarding system change. So I appreciate your speaking to that. Samy, comments regarding housing?
All what Julia said, but I think that first is that we need to recognize that New York is one of the only states in the entire country that has a full right to housing. By law, every single person should not go homeless every single night. So the state has a fiduciary responsibility to provide housing for all, right? So I think that, and whatever narrow way that the government interpret that, but if we look at the law, its intention, as in its intent and purpose, its spirit, is to make sure that everyone has a home. In one of the richest cities in the world, there's no way that people are homeless. So to be brief, we need to cancel rent first, right? I don't care how you do it. You're gonna provide relief to landlords, provide relief to small homeowners, and provide relief to nonprofits who provide affordable housing. Do it. But we need to put a suspension on rent for people, particularly LGBTQ people who are struggling with rent. Today, HRC released a report that found that LGBTQ people of color reported as their landlords for an extension in rent as twice as likely as white counterparts of LGBTQ people and the non-LGBTQ population. So it was 15% of LGBTQ people of color. So because we know that it's intrinsically connected to employment. And when it comes to the homeless population, right, how are we going to address a public health crisis when we have people sleeping in the trains, in the streets, and have nowhere to go? The hotels, it's a patchwork. That's not a solution. We have thousands of empty apartments in New York and luxury apartments. So while the state is spending, this is also economic. For the lawmakers and policymakers that like to approach this from an economic perspective, it does not make sense to spend $7,000 for someone to be in a homeless shelter or in a hotel, which is still housing instability, when you could pay $2,000 or $3,000 for a studio for a month, right? So if we start moving housing in stable populations to more safe housing, we could start, reducing the anxiety, but also providing some stability that Deborah Glick was talking about, right? Housing first policies. But housing is not a hotel room that does not have a kitchen, that does not have a microwave, that you still have to go out to buy food, that you don't have funding to do that. And it's not a homeless shelter where you have crowdiness of 50, 40 people, and then you're still propagating coronavirus, right? So I think housing first policies is the way to go, is the most important thing, and we could achieve all of those things.
Thank you. Thank you,
It's
Samy.
about the willingness, and it's about because of the real estate. So we need to make sure that elected officials stand up to the real estate lobby, and we could achieve that.
Thank you. Brad, comments regarding housing?
I'm in agreement with everything that's been said so far. I think we've shown in Albany a new trajectory in terms of protecting tenants. Not to pat ourselves on the back, but it was a big shift last year when we passed the new tenant laws and presented them to the governor for his signature or veto. We really, I think, have to recognize how far we've come, although it did take 100 years for us to get there with the Republican Senate. But it's because of new members like Julia and others that I think that have given us the backbone in the Senate, and with the Assembly having fought for these issues for so many decades, we were finally able to join them. Housing is, of course, directly related to your first set of questions around healthcare. And that's why we fought for the 30% rent cap. And that's why we look at, supportive housing and supporting, the creation of housing for the most vulnerable in our communities. And it's why we need to look at revenue. And we need to end tax giveaways like 421A that costs the city of New York billions of dollars a year to build luxury housing that's supposed to throw off so-called affordable housing, but doesn't work for anyone. The city and the state should get in the business, I believe, of directly building affordable housing. Why outsource it to luxury developers who can't do it very well, don't do it efficiently, and rip the taxpayers off hundreds of millions of dollars? So that needs to stop. And when 421A expires, I'll be the first to toast a glass of champagne. The other thing is that we need revenue to support new housing construction. So everything, we've talked about millionaires tax, billionaires tax, pied-à-terre tax. stock transfer tax. If the federal government isn't going to come through, and we're waiting to see, and I get the strategy, Cynthia, that we're waiting to see what the feds are going to come up with over the next few weeks. But if that's not the case, it's going to be up to Albany to make some really difficult decisions, not so difficult for some of us, about the need to tax the very wealthy in order to protect the most vulnerable. That's really, I think, fundamentally what our role in government is about. The wealthy, most wealthy in my district, and Deborah's, we share a district, can, pretty well look after themselves. So we need to start focusing those resources and making certain that, we house the homeless and give them the health care that they deserve as members of our society. So that's the big picture stuff. But the short term is going to be the revenue question that we're facing in Albany from the feds. And then if we don't get what we need, what can we get? What can we do in the state? And then, over the next couple of days, we've got, questions. The bill that Julia mentioned that, that I carry that stops tenants from being evicted during the pandemic. That's great. But here's the truth. When your fingers snapped and the pandemic's over, that doesn't mean that you're going to be able to, start your life and get a job and start paying your rent. So there's going to be some serious lag time around COVID-19, and we're going to have to figure out a way to deal with that housing insecurity in that period. But of course, the bigger picture, which Julia and Samy mentioned.
Okay, thank you. Thank you, Brad. I'm actually taking notes on what's being said. I'm going to jump to education because I know we have to stop in about 15 or 20 minutes. I want to cover a little bit about education and employment. I think any of us that have had children in school or are remotely aware of what's been going on with education, the differential impact regarding students that have technology, have access to technology, whether it's the internet, equipment, how to keep students engaged. I mean, everything is anecdotal now. I have a family of teachers, but it's something like 50% of their students are not attending. Teachers are saying there are all kinds of extenuating circumstances at home. Maybe they're taking care of other kids. Maybe their parents are essential workers, fighting, giving incompletes. So there's a lot of chaos going on regarding education. We have to think differently about education going forward. And that's whether it's grade school, high school, or even higher education. It's unclear, people going to college. People want to pay $50,000 to have Zoom events for their college experience. So Kyle, let me start with you and just give me some of your thoughts regarding education so we could hear a little bit from all the panelists and then go to employment and other comments.
Yeah, no, absolutely. I look at everything through a lens of equity. As we're moving forward and enacting new policy, it's a question of, are we ensuring that these policies that we're putting forward are equitable? That the result that they are intending to have, that it's across the board, right? And then likewise, as we enact policies to change behavior and laws and policies that we've enacted in the past, are we thinking about how previous policies have impacted different communities disproportionately, and are we taking the opportunity to address those inequities in the system? And I think that education is obviously one of those areas where the inequities are high. In every respect that you look at, whether it's specialized schools, whether it's college readiness, the numbers show vast disproportional impacts for communities of color, and that inevitably includes LGBTQ plus students as well. So I think that as you mentioned, and it echoes somewhat what Governor Cuomo said, we need to rethink or think differently about how to approach education. I think that's absolutely correct, but I think it starts with funding education equitably. Not picking and choosing types of schools that will get money, but ensuring that the schools that have demonstrated that they have the greatest need are receiving those funds. And yes, you can track it and you can make sure that funds are being used appropriately, absolutely. But it's about getting the right amount of money out the door. And in New York, it's getting the money out the door that the Constitution of the state of New York provides for. So we need to be funding schools adequately, number one. And we do need to rethink the way that we're educating our students. I, for one, am not a parent yet, but I've taught. And it's important, like when you teach, you understand that students don't come to a classroom on the same footing. Like you alluded to, there are students who are at home right now, who are taking care of their siblings, who are perhaps taking care of a sick parent or a sick guardian, or it's just hard for them to be able to engage in this way, right? Like we're all attempting to adjust ourselves to being at home and attempting to do work. My dog's running around here. I think I heard someone else's dog earlier. So we're all attempting to adjust, and we're adults. That's hard for students to be able to do. So, right, having access to broadband, having access to the internet, I think, again, this pandemic is highlighting things that many of us knew, were there before. But like, having broadband access to everybody the same way, we make sure that everybody has electricity. Access to electricity is something that's necessary. It's not just a luxury. It's not just to be able to, hop on Netflix. It's so that students can supplement their education. And in this case, when there's a pandemic, when when we need to stay home for our health and our safety, that we have access to the education that we need. We're going to come out of this and we're going to see those disparities, exacerbated. Students who were able to have parents at home, who were possibly able to pay, tutors or nannies to be able to come in and help them out with multiple students or tutoring or what have you, are gonna be fine. They're gonna, reach the level that they should be reaching in their grade. But then you're gonna find other communities, communities that are traditionally disproportionately impacted, communities of color, LGBTQ plus communities, poorer communities left behind. And that's going to have devastating impacts, generations to come. So we have to address it. And number one, it starts with funding.
Thank you, Cal. Julia, do you have comments regarding the educational funding formula? I know the governor had made suggestions about how to think about it differently. Should we be looking at a district approach and even more focused? What are your thoughts?
Yeah, I think that the Alliance for Quality Education, AQE, and the Campaign for Fiscal Equity lawsuit against the state for failing to adequately fund many of our public schools, especially in the city, demonstrated that there's a need for us to finally, for the state to finally equitably fund our schools. Schools based on the foundation aid formula that was essentially a product of that court ruling. Schools in my district, for example, are owed at least $50 million by the state of New York. There are a lot of school district or a lot of Senate districts, a lot of schools individually that are owed even more money, and it is not a coincidence that these are mostly in Black and brown neighborhoods. I think that it's about priorities again. In the state budget, the last thing that we should be thinking about, or in reevaluating the financial plan, which now we'll be doing regularly for the foreseeable future, the last thing that we should be considering is cutting funding to our public schools. I think that additionally, students really need to have access to the internet at home. Some of the resources that go to our public schools can certainly be used to provide devices for students. I know that the city has taken initiative to try to do that and urgently do it, because this crisis has really demonstrated the need for that, with a lot of students not even being able to engage in remote learning. But additionally, I think that a long-term response should be municipal broadband, and ensuring that everyone in the city, it's not as radical as it might sound, and it's certainly not unprecedented in other parts of the world. We can make sure that everyone has internet access, and that the students in my neighborhood don't need to go to the library in order to be able to access the internet. So that's more of a, I think, an aspirational long-term response.
I like that idea. Municipal broadband. What do you think, Samy, Brad, to that idea? Samy?
I mean, yes, and that's just like a very small part of it, right? Because particularly in Bushwick, I'm in the Community Education Council, which is kind of the school board. And there's such like a myriad, broad range of issues, because even if you have Wi-Fi, which I think that should be, you know, treated as a utility and free, expanded for all, I think one of the issues when it comes particularly with immigrants communities, English speakers as a second language, multilingual languages, which is basically 80% of New York City. The issue that we might need, we're only, when I'm here, the conversation is about the students, but now the script has shifted. Now we're not talking about the student, it's about the parents, because now it's the parents who the ones that need to be educated. The parents are not gonna, the teachers, if there is no discipline or knowledge from the parents of how to use the internet, how to use an iPad, how to educate their children will have really serious gaps in their education, right? So in communities like Bushwick, where mostly are Spanish speaker, undocumented population, many of them illiterate, they have no idea how to educate the children, especially not to mention deal with those like devices. So there is a huge need for some type of support and resources to the parents, right? So that they can actually have the resources and the knowledge on treating, on educating the children. That's one aspect of the kind of like complicated system of the Wi-Fi and the remote learning. And when it comes to LGBTQ students, who many of them are live in unstable housing, they have no parent, right? They don't have no support network to actually guide them through what is remote learning, right? So that just further like exacerbates dropout and, you know, all those sort of a lack of connection with the school community. And I'm particularly, you know, that's more like to the high school population, and then but the younger population. And yeah, I think that there has to be a plan to address that population that don't have family, and you know, and or their families are not supportive, particularly LGBTQ people. And I have no answer or creative solution at this moment, but we need to continue think about that population that won't have a parent 8 hours of, you know, 6 hours school day to just guide them through remote learning.
Thank you, Samy. I'm going to move to our last question. We have just 5 minutes before doing some closing remarks, and I mean, it's related to employment. I think that I think our notion of what are essential workers has been broadened. We understand the need more deeply. They are often disproportionately people of color. Many within LGBT plus community are represented either in the field of essential work, or have been impacted by loss of jobs because it's been in, you know, entertainment areas or restaurant areas, et cetera, et cetera. So does anyone have any creative ideas regarding whether how we prepare for this again? Should there be some different kind of compensation or added compensation for essential workers? Is there any kind of new creative idea regarding how to get the workforce back as quickly as possible in ways that are safe? So just those two, I mean, they're huge areas, but if you could just limit your comments to a minute or two, I think we'll have to begin to go to closing remarks. So, Brad, what are your thoughts regarding employment, both maybe a work compensation or not, and how do we get those of us doing kind of regular work, not the high-end professional work, back to, working.
Well, I think it kind of, you need the public infrastructure to support all of those essential workers, and that's what we've been talking about this whole evening, whether you're LGBTQ or not. You need subways that run 24/7 and are, and are efficient and consistent and well-funded. You need a hospital system and a healthcare system that, provides for everyone and including children, including undocumented. And you need an education system that teaches children how to read. Cynthia, my daughter is 9. We found out that she was dyslexic this year. Now, you tell me why, when 15% of children have a learning disability that consists of dyslexia, why kids of every background are not screened immediately as soon as they step foot into the public school system. And the reason is because if we knew that we had that problem, which we do, 15% of kids are dyslexic, we wouldn't be able to commit the resources. We don't have the courage, unfortunately. We are feckless when it comes to funding public infrastructure like our schools, even though the Campaign for Fiscal Equity says that we owe the New York City school system $3 billion. We just need will, courage, a new resolve as we exit this pandemic to do things the right way and to make certain that people like our essential workers are supported and not wearing garbage bags instead of PPE when they're trying to do their job and save our lives.
Thank you. Kyle, final comments related to the issue of employment? So should essential workers, one of our viewers is asking, be paid an essential wage?
Yeah, absolutely. I'll keep my comments brief. I think that it's disingenuous for us to call people essential workers, but not, provide them with an essential wage. I think that, the people who keep New York City running, as you mentioned, whether that's, people driving the subways, people driving the buses, getting people to work, people who work in the restaurant service industry, people in the medical profession. These are people who, as those of us who are professionals or who work in government, as we're able to sit at home and do our jobs from our phones and from our laptops, there are professions that absolutely cannot do that. And that's why we refer to them as essential workers, but they're not being paid as such. We've done a lot of work, the Caucus specifically, as well as the state legislature, to bring about a $15 minimum wage for most workers in New York, but not all. We still operate under a 2-tiered system. That needs to change. If you are a tipped worker, you should be receiving minimum wage as well. And if somebody wants to tip you on top of that, great. So we need to, again, I look at things through an equitable lens. There are systems in our society that are not equitable. Again, being called an essential worker, but not receiving an essential wage, being in a position where you're not able to pay your living, your living conditions, whether it's rent or mortgage, and provide for your family. And on top of that, also being able to save, right? Like, there should be options for people to be able to save, to be able to earn interest on their money, so that when we find ourselves in these positions where we're dealing with another emergency, another pandemic, another catastrophe, we're not rushing to do legislative hearings and session via Zoom to pass all these short-term solutions to major problems.
Thank you. Thank you. I want to ask both Senator Salazar and Senator Hoylman one last question, which is should we be expecting any LGBTQ anti-discrimination legislation coming out in this week's work? Julia?
That's a good question. As far as I know, there isn't legislation that's currently being considered there that's on the agenda immediately, that's explicitly addressing discrimination. Senator Hoylman, if there's anything that I'm not thinking of, but I think that it's really, really valuable that last year the legislature finally passed gender. There are still laws in our state that, and maybe this isn't immediately related to COVID, but there are still laws in our state that are perpetuating discrimination against, especially against queer and trans New Yorkers, whether it's the loitering for the purpose of prostitution, as it's called, statute, or the fact that sex work is criminalized, and the many manifestations of that include people experiencing housing discrimination if they engage in sex work, or even if they're just suspected of engaging in sex work, something that really disproportionately impacts especially trans women of color, but the LGBTQ community in general. And those are things that I think, we're not talking about passing them this week, but things that Senator Hoylman and I have definitely been working on. I don't know if I was going to add.
And let me add, yes, and Senator Salazar is a great partner, along with a number of my other colleagues who are recently elected and have what I would regard as like a fresh look at how we've been handling LGBTQ issues of bodily autonomy and agency, such as sex work, and as the criminalization of it impacts transgender folks, particularly transgender women of color, and I really find that refreshing, and it's been a positive change. I think in the, Cynthia, we're looking at data collection around the LGBTQ community. It's something we haven't been doing in New York State. They say you can't manage what you don't measure, and we haven't been managing the health impacts of COVID on a whole range of populations. We don't even have the data, Cynthia, on essential workers, on healthcare workers, on the impact of COVID on them, much less other segments of our population that we're going to have to understand what this pandemic has meant to them and what policies we need to propose to address it. Certainly things like in the coming year, the Gender Recognition Act to make it easier to change gender markers on government IDs is something we want to pass. Senator Salazar mentioned repealing the Walking While Trans ban, which targets transgender women of color, requiring schools to establish policies to ensure that transgender students are treated fairly is an important initiative. The state education department, I think, should have a curriculum around LGBTQ history so they can study people like Larry Kramer and Edie Windsor and Bella Abzug, who all lived in the same building in my district.
Amazing.
Along with Ed Koch,
Right?
along with Ed Koch, another LGBTQ figure, whether he wanted to be one or not. And I need to look at the other end of the spectrum too, how our LGBTQ seniors were treated. We're looking at nursing homes now. We need to have an LGBTQ long-term care facility residence bill of rights, because those individuals, and we're going to find out more as this story unfolds, have had disparate treatment in these long-term care facilities because of their sexual orientation or gender identity or expression.
Thank you. I want to thank you all, Samy, Kyle, Brad, Julia. So nice to meet you this way. I promise to meet you in person as soon as we can get together. I will say I'm very familiar with the list of legislation you both talked about. New Pride Agenda is deeply involved, ready to lean in when the time is right, open to your guidance, both Senator Salazar and Senator Hoylman, of course, always. And of course, Assemblywoman Deborah Glick, who had to get off. She's been texting me, so whenever you see me turn away, I'm just politely responding to our elected official. I thank you all for your comments. I took lots of notes, which is unusual for a person like myself, but it was good information. And I want to turn it back to Ahmed and Jason for some final comments. Should we start with Ahmed or Jason?
Yeah, I'm going to be brief, so I'll quickly
Okay.
just talk about
Thank you.
our website. First of all, thank you guys. I want to reiterate, this has been a very productive conversation. I've learned so much in the last hour. We've been recording this town hall, and I'll post it on our website later this week so that other viewers who couldn't be able to make it can view it and learn from it. And we'll also be updating our advocacy page with a bunch of different pieces of legislation that were mentioned today and weren't mentioned today, but all have to do with the conversation that we've been having. And so I'm going to turn it over to Jason, who's going to talk about future town halls before we say goodnight.
Great, thanks, Ahmed. Thank you, panelists, for your remarks, for your work, and your commitment to New Yorkers. Want to let our audience know that this is the ongoing virtual town hall series that we're doing to. This is an ongoing virtual town hall series that we will continue to do and produce to make sure that we stay connected in community with each other and talk about key issues that impact our community. Our next town hall will be on June the 11th. That's a Thursday, and we're going to be discussing income inequality and inequity. And then also later month in June, we will be having another virtual town hall to talk about immigration policies and how our communities across New York are working together and are struggling to combat this epidemic.
Thank you, guys.
Thank you all.
Enjoy your evening. Bye.
Good night.